Chapter 8, Dr. Landreth's book on marriage and family play therapy, the parents part of the process. Obviously, children are not adults. If you are having play therapy clients who are adults, this particular chapter wouldn't apply. But when you're dealing with minors that are dependent on a significant adult to bring them to therapy, to provide insurance or payment for them, parents need assistance in informing their children about the process, and the parents also need to have consideration. So it's a fine line between the confidentiality and privacy issues and then the family counseling part. My rule of thumb that I tell parents all the time is, and I tell it in presence of the child, if the child is in session and tells me something that's troubling, something that's reportable, I let them know very clearly. We have a written informed consent that they sign, but we also break it down according to the ethics code and the law in layman's terms, which is about at the 6th grade level. So I will say to them, if you tell me something that worries me, that troubles me, that makes me feel that you're not safe, that your child's not safe, I'm a mandated reporter. And what that means is, and I go through the process, and that I'm a voice, an advocate for those who have no voice, the children, elderly, the disabled. If there is mental, physical, sexual, emotional abuse, extreme verbal abuse, because verbal abuse is much more difficult to prove and to get help with state agencies, but it still exists. If I think that you're a threat to yourself, others, or the community, at that point we're going to go straight to a mandated reporting status. But I will let you know if it becomes necessary for this to occur, then I will tell you. Secondly, I tell them, but your child has to have some privacy. They have to have some type of confidentiality. And I give very practical examples. If your child gets in there, they're very, very angry, and they tell me that they hate you. I may not come out and say, hey, guys, your child hates you. I may say, your child is very angry, very hurt, having a very difficult time expressing their feelings appropriately. The only time that we're going to get very specific if it is a mandated reporting situation. Also, when I'm listening to the parents give me collateral information about the child, if that turns into an attack against the child, I will not have the child sit there and listen in present, listening to their parents have a lot of really harsh things to say. The child will be excused. And then I will talk to the parents about what is good about your child. What are you proud of? And the best way for us to talk about them in front of them to get optimal success. But parents and teachers can certainly give you a lot of collateral background information. The interviews provide a lot of useful information. If you look at page 152 and 153, they give you Dr. Landreth gives you a case study about a little 4-year-old named Paula that you can look at. Just because you get collateral information or the parent says, well, I really need for you to cause my child to be able to clean their room up, that doesn't change the approach. The collateral information does not become prescriptive. It becomes collateral. It's in addition to. So you don't disregard the information and you don't change everything about your treatment plan too. Some counselors, if you look at page 154, are unsure about whether or not the parents must also be in therapy. Typically, as marriage and family therapists who also practice from a play therapy standard, we believe that if there's something wrong with my child, there's obviously something not right with me. Not meaning that I'm a bad parent, but that my heart and my home is disrupted and I'm in pain because my child is having problems. Our model typically is to check in with the parents the first 10 minutes or so, find out what the week has been like, see the child in the mid-range of the session, and check back with the parents for a few minutes. There could be some variations from that if the parent has a great deal of things that they need to say. So we look at that. We also will understand that some play therapists are school counselors, and that those counselors sometimes have a great deal of contact with the parent if there are problems with the child. Sometimes much less if they're just meeting with a child during the course of the school day. Residential institutions where parents are foster parents or the parents aren't available. So many of those things change the way that we're able to work with families. Optimally, you try to include the families as much as possible. Admitting that they need help or there's something wrong with their child is very sensitive, very difficult. The parent's own level of emotional adjustment and level of frustration tolerance may be a determining factor. Sometimes when children are seen to be disruptive or not doing what their parents or the school systems want them to do, parents can over-discipline or move over to the point of abuse. Sometimes they're brought into counseling just simply because of those things. Page 158, 159, 160 and 161, 162 and 3, 64 and 65 go through a complete therapeutic session where there is a parent interview taking place that is there for your perusal. Obtaining permission from a legal guardian. If we have children who come in with parents who have divorced, we ask for the custody papers. Sometimes it is joint legal custody for both parents. If it is joint legal custody and the other parent doesn't know, we will request that the parent bringing the child in alert them. If not, we will at least send a letter and will invite them into session. Sometimes that's not the case. Sometimes the other parent is gone. Sometimes both parents are gone. And you have a foster parent or an adoptive parent or a defects caseworker. Whoever has the legal ability to sign the consent form must be included. As you are, and we don't go out of the practice, but there are counselors who go into the home and go into the school. All of these things have to be very specifically outlined and signed off on by the legal guardian of the child. As in any kind of referral, we can refer a child out because we're not able to see them, or a client out. But we also can refer out to medical, psychiatric, to support groups, and continue to see them. In the psychiatric referrals, in the case of potential suicide, the emergency room involve medical professionals one layer above us. Spread the liability, spread the responsibility, spread the assessment and the interventions. So if we do a psychiatric referral, we expect the parent to provide us with proof that appointment was kept. If we send a child to the hospital for the emergency room for evaluation, we expect a phone call, we expect documentation that this occurred. And explaining play therapy to clients and to parents. We typically show the parents, we give them a tour, we show them for what we're doing, what we have to offer. We give them some literature to read, we have videos for them to peruse, we have time to sit down there with them. If the child is open and it appears to be therapeutically appropriate, we will allow the parent to be part of it at some point after the client becomes comfortable. We will always ask the client, why are you, particularly with their children, why are you here? Why do you think you've been brought here? What is going on? How can we help you? And sometimes the child is very uncomfortable or reluctant to leave the parent. If that's the case, we do not force it, we allow the parent to come in. But we're working toward always the ability to have the child in session with the therapist, at least for a portion of the therapeutic hour by themselves, so that more work can be done, without ever excluding the parent as part of the larger system that the child needs to grow and develop and find the agency of change that we're all looking for. So that takes care of that chapter, and we will reconvene with chapter 9.